Well, the CDC is now advising what activities fully vaccinated people can do, but it is still asking them to avoid other things like serious travel. And it's raising a lot of new questions now. Dr. Leah Lee, an infectious disease specialist with Beverly Hospital, is joining us once again. Thank you, Dr. Lee, for being here with us this morning.
Good morning.
Good morning. I want to start with that new CDC guidance for the vaccinated Americans out there. So what safely constitutes a small gathering that is approved? And let's say what happens if a person goes one over the limit, because there seems to be wiggle room that a lot of families would like.
Right, there is quite a bit of wiggle room. Unfortunately, you don't have specific numbers when you're talking about a small crowd. The guidelines which came out on Monday were actually a welcome relief to most people who've been suffering through this pandemic. And right now, the key points for the guidance are, number one, fully vaccinated individuals. That basically means individuals who are 2 weeks or more out from their second dose of either the Moderna vaccine or the Pfizer vaccine, or 2 weeks or more out from the single dose of the Johnson & Johnson. Those fully vaccinated individuals can actually gather with other fully vaccinated individuals inside without social distancing and without masks. The other situation which comes up is that fully vaccinated individuals can now visit with members of one household who are not vaccinated, and don't need to social distance or wear masks, provided no one in the household has any serious risk for developing severe disease. And that would include conditions such as sometimes diabetes mellitus, pregnancy, chronic lung disease, chronic kidney disease, or those individuals taking immunosuppressives or organ transplants. And then finally, the last key point for the recommendation was for individuals who are now fully vaccinated, if they have been exposed to individuals who have COVID, they no longer need to vaccinate. They no longer need quarantine or tested, provided they have no symptoms, I should say.
Gotcha, because they have the vaccine. It's there's just we're constantly getting new updates here. We understand also Moderna just launched a trial study for a COVID booster shot. We've been hearing about these boosters. How many boosters do you think might be needed with so many different variants kind of going around internationally?
No one really knows. I mean, the trials are currently in place. They're looking at three types of boosters.
Okay.
One booster being a third shot of the current vaccine. The second one being a totally revamped booster with using a different blueprint for the virus. And then the third one actually using a combination of both. It's not clear which one will actually work the best. It is, however, important to keep in mind that when you give a vaccine, you are stimulating more than one component of the immune system. Antibodies only being part of it. So what we're seeing in the laboratory may not actually translate into real life in terms of what we're seeing. In fact, most of the vaccines that we're using right now, the three, seem to offer some protection, although not complete.
So then do you think down the road, because a lot of people are wondering, how many shots am I going to need to get? Could we need multiple boosters each year to kind of stay ahead of this virus?
It's hard to say. No one knows at this point. It's still very early on. We've been with the pandemic for the last year, and the vaccines have only been out for about the last 6 or 7 months. So time will tell. I think most authorities feel that we probably need a booster probably once every 1 to 2 years, but we won't know for sure until the data comes in later on.
And with now 6 months into this, what is the latest research on how effective these current vaccines are, especially against those variants? I mean, are they still successful, you think?
Yes, they do. They offer some protection against the variants, albeit to various degrees. With the UK variant, it has been shown that the vaccines actually will neutralize the antibodies will neutralize the virus. With the South African, probably quite not as much, but again, they do offer some protection. Again, we will be seeing the data in the coming months as we do more testing.
Well, Dr. Lee, thank you again for your time and helping all of our viewers at home know what is going on at the moment, because so much is developing. We really appreciate it.
Well, thank you. Have a good weekend.
You too.